The following segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
A new, rare, and serious inflammatory syndrome linked to COVID-19 is cropping up across the country and in Utah. Dr. Andrew Pavia with University of Utah Health and Primary Children's Hospital is here to explain what parents need to know about this. And doctor, first of all, what is multi-symptom inflammatory syndrome in children?
Well, it's a newly discovered and pretty rare syndrome that we're seeing in children that follows COVID-19 infection. So it's not the infection itself, but it's something that we're seeing days to weeks afterward. And it involves inflammation of many systems of the body, hence the name. Presents with high fever, often with a rash, sometimes red eyes, swollen hands, and then heart muscle, liver, and other organs can be involved with intense inflammation.
Well, we kept hearing that kids really weren't at risk for COVID-19, so that's pretty rare, but what should parents be keeping an eye out for?
Well, this is not a subtle syndrome. Parents will be aware that their kids are really quite sick and getting sicker. The fever tends to last a number of days. The rash is quite distinctive, and there's often a lot of abdominal pain. So this is the sort of thing in which you would feel normally that you'd want to bring your child in to see the doctor. So if you are worried about it, you should contact your healthcare provider immediately.
And the best prevention or the best medicine is prevention, right?
Well, absolutely. This is a complication of getting the virus.
Right.
So we think only a tiny percentage of the people who get the virus, or children who get it, will go on to get this MIS-C when they're recovering. But if you never get infected, you're never at risk for MIS-C. So all the things we do to protect our kids, social distancing, masks, hand washing, avoiding very large gatherings, that's going to prevent MIS-C just like it's going to prevent the primary infection. Remember that the viral infection in kids is not as severe as it is in adults, but this late complication, although rare, is something that worries us.
Okay, prevention, prevention. Thank you so much, Dr. Pavia. If you want any more information on this and other issues, go to our website, KUTV.com, and click on Baby or Baby.